So hello, everyone. We're joined today with Dr. Angelique Coetzee. She's the chairwoman of the South Africa Medical Association and among the first in the country to detect, to suspect that a new variant was suspicious, was making people sick. Dr. Coetzee, thank you for joining us.
Thank you, and it's only a pleasure and a good afternoon to all your viewers and listeners out there.
So first of all, let me make a recap. What made you suspect that what you were observing was another variant of COVID? What happened that day? I believe you said it was about mid-November.
Yes, it was the 18th of November, 18th of November. It was a Thursday. You know, we haven't seen COVID cases for about 8 weeks. We went through our third wave, and we predicted the fourth wave for the end of December, beginning of January, due to behavior, you know, based on behavior that we would expect would happen over the festive seasons. So the patient that morning came with complaints that he thought was something different. He thought it was heat stroke. I listened to him. There was a few things, you know, that didn't make sense what he was saying to me. And being 33 years a general practitioner, you know, you are quite knowledgeable about symptoms and how patients present. That's part of your job for 33 years. So when I examined him, I decided, let me just test him because something doesn't add up here. And he was positive. I think he saw the shock on my face because the moment when I saw this is positive, I knew we are in trouble. Something, I remember I went and I grabbed my head and I was just looking at it and I couldn't believe what I saw. So then from there on, the rest, his family also made an appointment that morning, and that was also unusual. So they were all positive. Saw more patients that day that's positive. Realizing that this symptoms does not fit Delta, I alerted my advisory committee and said, listen, something is wrong. I'm seeing a different picture here. At that stage, I thought it might be similar to Beta variant, or I queried a new variant, but never thought it would be true. So simultaneously, and I think this is important, that one of the lab technicians with someone else's sample pick up that there was something wrong with the PCR testing that they use with that specific samples. And they also alerted NICD, and then the scientists started to look at it, and about 5 days later, they told us, yes, that there is indeed a new variant. By the time that they announced it to the world, we have already seen these patients coming into the surgery for about 5 to 6 days. And so we also noticed in the clinical picture, again, stays more or less the same. And that's how we started. And we would still have maybe not spoken out about the clinical picture that we have seen, except that when it was announced to the world, the UK slammed us with a terrible travel ban, which we thought was totally unjustifiable. At that there was no there was no reason at that stage. We were honest. Our scientists were honest, saying, we don't know. This is the concerns, and that's when we started to speak out and say, but listen, this is the symptoms that we are seeing. And so we were still being told by a lot of people, you know, it can't be like that. It should be, they should turn. Well, it's now today 3 weeks, still waiting for the patients to turn. If it was Delta, I remember clearly the 3rd week of Delta, we were starting to ask the government, please close down the schools, please close down. The influx of people are quite enormous, and the people are sick. We don't see it now, although there's a high positivity rate. Mm-hmm. Not all these patients come to the surgeries because they're not really very sick.
So you think it was, you know, you saw how many countries reacted, and they closed the borders to the country, to South Africa. So you thought this was an overreaction, right? Based on the fact that you described the symptoms are are mild. They're not so severe, right? Am I
Yes.
correct? As you said, you were shocked with the clinical picture of the first patients.
With the test, the positive test.
The positive test of the pill.
Yeah, I immediately knew what was going to happen because the symptoms not the same. We're going, you know, we are too early. It's still not the last week of December. And we went through a terrible time last December. I know every country who had seen or dealt with Delta know it is it's a devastating disease. So now you're sitting here with something and you don't know that, I realized immediately something, we're not going to have a good Christmas.
So what is the main symptoms? What are the main symptoms of the variant? From what you described, this is not a lack of smell or taste. It's not particularly any respiratory problems there. But what is the main problem? Is it fatigue?
It's fatigue. So there's three main complaints that the patient will come with, and most of them have all three. So it is the myalgia, it's the body pain. And the body aches and pain, they will tell you, my muscles are extremely sore, doctor, got backache. Then they will have a headache and that fatigueness, not a lot of energy. Lethargia is another word that one can use for that. So that's the three main symptoms that they will come in and present with. They might have a sort of a scratchy throat. They might have sort of a dry cough, but not very prominent. But no one has, as I've said, loss of taste, smell, oxygen levels are normal on each and every patient. We do that routinely. Up until now, I'm not aware of any family practitioner in primary healthcare prescribing oxygen to any of these patients at home. So far, and as I've said, today is 3 weeks, these patients do extremely well. There are, however, a slight increase in our hospitalization in ICU, and it seems at this stage, depending on which stats you're looking at from certain hospitals, between 87 to 90% of the people admitted in ICU is unvaccinated. Unfortunately, our stats don't distinguish between Omicron versus Delta. Also, please remember, Delta is still here in South Africa. It's not gone. So we need to have that stats to correctly being able to attribute the disease that you are seeing to Delta or Omicron, especially if the treatments are going to be different in ICU. You need to know which viral variant you are dealing with.
So we hear a lot about this variant. One of them lately being that people get reinfected more easily with Omicron, even more so the vaccinated, if I'm not again mistaken, because many people want to know if they are vaccinated, are they protected against this new variant that you have helped identify. And then a new study from South Africa indicated that apparently Omicron evades the Pfizer vaccine, for example. So are vaccinated people protected from
Yes, let me answer that from a clinical perspective at primary healthcare level. And I want to say, yes, you're still protected. So we are telling our patients or our people in South Africa, and we've been honest from the start, right from the beginning, we vaccinate you to get you out of hospital, to prevent you from having severe diseases. So what are we currently seeing? We see reinfections, patients previously been infected, getting infected again. We are seeing patients reinfected, fully vaccinated, again getting Omicron. We are seeing unvaccinated patients getting Omicron. We are seeing fully vaccinated people without any prior disease also get breakthrough infections. But this is the beauty of what we are seeing at primary healthcare level. 99% of these people are mild cases. However, the question, the $1,000 question is what is going to happen at hospital level in ICU. That's because we know at primary healthcare, it's not really a huge problem. We're not saying that you're not sick if you have mild disease. We are just saying we can treat you at home. You don't need oxygen. You don't overburden the system at primary healthcare system. The answer lies in, or the question is, and that is the data that we're waiting to see within the next 7 to 10 days, because we know the T cells take about 2 to 3 weeks before you would know whether you're fully protected. We will, the cytokine storm, we're still waiting for that to see, again, vaccinated versus unvaccinated people. And why this is important is you will get people now saying, why should I go and get vaccinated? We all get infected. Right. Well, we are saying to you, yes, you will get infected, but you will get mild disease. However, our hospitals in our ICU is unvaccinated people.
Still. Two more things, Doctor, aside from vaccinations. If this variant makes the virus more transmissible, does that mean that more elderly people will get infected? And how concerned are you about this? You know, in Greece, 22% of the population is estimated to be over 65, whereas in South Africa, this percentage is about 5.5%. So would you be concerned if, let's say, if you were working here instead of there?
So again, the whole thing goes around the vaccine. So I have seen my oldest patient is 82 that got a breakthrough infection, fully vaccinated, lots of comorbidities, and she went through this like a breeze. We didn't even follow her up. So, you know, there was no follow-up on her clinical because she was fine. We still wait now to see the unvaccinated elderly patients. That will tell us how severe Omicron can be. With older patients, with more comorbidities than the younger people. And they normally are infected later on in your upwards curve. And we are moving into that. That's why we keep on saying between the next 7 to 10 days, we will hopefully have that answer. And this is, again, so important. If I listen to what is happening in our hospitals, and the data come out saying unvaccinated people, that's the majority in ICU, then, you know, whether you have a breakthrough or escape of the variant with vaccinations, if you still get mild disease, that's a first prize. Mm-hmm. But we will see what happens to the elderly.
And how about the children? Because I read that the cases are rising among children in your hospitals, but children under 12 are not yet eligible for vaccines. So does that leave them more vulnerable?
Okay, so I think we need to answer this in the next, in this manner of saying, again, early in the disease, it's always the children and the young people first getting infected because they are close together, they're in schools, they don't wear their masks, we know all the social problems behind that. However, if we haven't seen a lot of respiratory tract infections, viral infections, colds and flu during our normal flu season, interesting enough, they actually started to increase in the month of November, if you look at the stats. So now a lot of these children will be admitted, let's say for a diarrhea or for a tonsillectomy or for whatever reason, or for a pneumonia. It's compulsory before you go, or not compulsory, but that's the norm. The norm is to get everyone tested before you admit them. So these patients then test positive, but that's not the primary reason why they have been admitted. And that skewed the data and got everyone up and say, yes, but now children are severely affected. No. We need to see how many children was only admitted because of Omicron or Delta. And that stats is also not available. But I can promise you they are not being, there's not a huge increase because we would have first seen them at primary healthcare level. That's how it normally works.
Mm-hmm. You got things straight. I'm so grateful for being able to speak with you this morning, Dr. Coetzee. We're in a situation where we have to wait and see. But it's very valuable that we have that information from you. One of the doctors that really realized that something was going on with the virus. Thank you so much for being here today and alerting the world.
Thank you so much. And if I can just ask your people, please look at the symptoms. Please go and get tested. Make sure that you're okay, and stay safe.
Thank you very much, Doctor.
Thank you so much, Christos. Enjoy the rest of your day.
You too.